السلام عليكم ورحمة الله. أنا عمر شاميه وهذا بودكاست بوفهد. ضيفنا اليوم في صناعة وقطاع هو الأكثر تداولا عالميا، قطاع الذكاء الاصطناعي. ضيفنا هو دكتور محمد حمود، عضو هيئة تدريس جامعة كارنيغي ميلون في برمجة الحاسوب. حاصل على الدكتوراه من 14 سنة ومؤسس شركة AVEY للذكاء الاصطناعي وتشخيص الأمراض عبر الذكاء الاصطناعي.
شكرا أبو فهد على الاستضافة الطيبة وسعيد جدا بلقائك اليوم.
أشكرك. طيب حنبلش شوي باللغة العربية اللي نحط نوع من الفريم ورك للناس. ما هو الذكاء الاصطناعي باللغة المبسطة؟
طبعا الذكاء الاصطناعي هو to train a model، انك انت تدرب a certain model, computer science model, AI model more precisely, that can learn and produce intelligent behavior. ممكن يتعلم و it can actually do intelligent behavior. مثال بسيط جدا كبداية، اعتبر مثلا انت عندك عملية الميديكال دايجنوزز، تشخيص، هيدي بيقوم فيها طبيب. خلينا ناخد مثل بسيط، اعتبر الآن انت راديولوجي دكتور، ممكن يشوف السي تي سكان او الام ار اي او الاكس راي ويقدر يحلل اللي شايفه ويعطي تشخيص، يقول مثلا فلان عنده فراكتشر، افش عنده فراكتشر. انت اذا اخذت هيدي العمليه وضعتها بالكمبيوتر وخليت الاي اي موديل هو يعمل هيدي العمليه، بيكون الاي اي موديل عم يعمل انتليجنت بيهيفير اللي هو بيعمله الانسان. فبالتالي الان this is what we call الذكاء المصنع.
طيب، ولذلك ونقاشنا الاساسي اليوم هو عن الشركه اللي اسستها AVEY. كيف ابتدأ AVEY ولماذا ابتدأ هذا المشروع؟
شوف، AVEY started when my son Ahmed fell sick with a chronic illness. My wife Ahmed and I went through a difficult health journey, which made Ahmed hope for someone who could make him better, and that gave rise to AVEY. AVEY هي شركة متخصصة بقطاع التكنولوجيا وبالذكاء المصنع. البداية أو الانطلاقة كانت to develop an AI model that can do medical diagnosis. طبعا الأمور تطورت over time، but هيدي كانت البداية تبع AVEY.
متى تم التأسيس؟
AVEY تأسست رسميا بال 2022.
جميل. من يعمل عليها ومن أسسها؟
طبعا أنا المؤسس لشركة AVEY. فيها beautiful minds from different segments, medicine, computer science, business, operations, marketing, design, UX, UI. One unique thing about AVEY is really the team. We try our best to attract the best minds out there. Because we strongly believe that we cannot have a beautiful product unless we have beautiful minds.
هنتطرق للتيم والتالنتس اللي موجودة عندنا، ولكن خلينا في البداية نذكر قصة الأولية. كيف بدأت المشروع بالضبط وكيف قدرت أنك تقنع سواء كانوا الفاوندينج بارتنرز إذا كان فيه أو الأوائل المستثمرين لضخ أموال بشركة في قطر بالذكاء الاصطناعي في سوق شبه ما كان موجود بهذيك الفترة. احنا نتكلم على 2022، حتى طفرة الذكاء الاصطناعي والشات جي بي تي ما كانت موجودة زي اليوم. فكيف كان توجهك؟ ايش كان فكرك؟ وبالنهاية لماذا؟ ايش الاشياء اللي احنا نطمح لها؟ Where do we see ourselves? What we are trying to do really in 5-10 years?
Yeah. So as mentioned, AVEY started with an idea. As usual, that's how it goes with the startups. As I mentioned, I'm a solo founder. I was lucky actually to meet some people who believed on the project and decided to fund it. So initially I had a pre-seed round and then a seed round. Angel investors mainly from Qatar and outside. That allowed us actually to start the R&D phase. And it's important to note the following here, that startups, from my perspective, are of two types. Startups that are deep in science and startups that do pure development. Startups that typically do pure developments, it could be a problem that has a solution, or a problem that doesn't have a solution but does not require research. So that is typically, from a computer science perspective, easy to develop. Yes, it takes time, but it's easy to develop because you know the solution. You just need actually to develop it. The other type of startups that are deep in science, you know the problem, but you don't know the solution. So we knew that medical diagnosis is a problem. You can do literature if you...
By medical diagnosis, you're referring to a human doctor medical diagnosis.
True. Human doctor medical diagnosis, for instance, based on a study from Johns Hopkins, around 250,000 people die every year in the US as an example out of medical errors. So diagnostic errors is a known problem, and I can maybe say it's a global problem. So we knew that the problem exists, and we are not the first actually to try to solve this problem. Many teams all across the globe, in the US and in other countries, tried to solve this problem. With that being said, we started the research phase, the R&D phase, and that took us some time. Of course, we tried initially off-the-shelf models in deep learning, but nothing worked. What we eventually ended up doing, we developed our model from scratch, bottom up, tailored for medicine. Medicine is very nuanced, and it has a lot of intricacies. And if you really want to achieve high accuracy, you really need to tailor the model specifically for this context. And that's actually what AVEY did, and proved scientifically over time to have a model that is decent enough now and accurate enough to be used in production.
And your team is fully based here?
100%.
Where are you based?
At Qatar Science and Technology Park.
Okay, so واحة العلوم بالعربي، كيف ساهمت واحة العلوم والتكنولوجيا في نجاح AVEY؟
طبعا of course we applied, they reviewed our project, they accepted it, they gave us the license as a company to do the R&D and operate. That was very helpful. They gave us the space support for years, and they have been supportive all across the years in many ways. Sometimes even if we needed something that pertains to regulation or whatever, they have an officer about that. They invited us to reach out and see how they can help. So as an ecosystem, it was okay. It was helpful.
شوي على أسئلة شوي علاقة ب خلينا نقول إدارة الأعمال أو ريادة الأعمال. قبل ما ندخل أكتر تكنيكال، هتكلم أكتر على موضوع السوق القطري وكيف وجهة نظرك من ناحية الشركات الناشئة وبالنسبة كبيئة أعمال، ثم أيضا التالنس اللي موجودة عندك كشركة بالذكاء الاصطناعي، شيء جدا متخصص. وهل عندنا خلينا نقول كمية من المواهب اللي احنا ممكن تستخدمها الشركات الناشئة في تطوير برامج على هذا المستوى العالمي مثل AVEY؟
نعم. So I was lucky because I'm at Carnegie Mellon. And I was able to tap into an excellent pool of talents. I teach the students there. By the time they graduate, I typically hire almost every year a couple of excellent engineers who join AVEY as full-time engineers. So engineering has not been a problem, or science, computer science has not been a problem for AVEY. Of course, also this applies to design and UX UI. We hire from VCU. This applies to communication and PR. We hire from Northwestern. Bottom line is that the existence of the education city in Qatar helped a lot in the journey of AVEY. This is a pool of talents that is available for all kinds of startups and companies in Qatar, and I strongly recommend all these actually to tap into that beautiful pool of talents.
I agree with you. I have almost 30% Qatar Foundation graduate as well here in Cozette. So with regard to the diagnosis, how did it start and how did it evolve? And how many times did you actually think about quitting?
Oh, these are two different questions. Let me start with the latter.
Okay.
You see, they always say that startups do not fail, but founders give up. I will never give up. Of course, it comes sometimes to the mind that you start questioning the things that you do, but with persistence and dedication and grit and logic and having a beautiful team, a team that we complement each other with the skills that we have. We have shared principles and common values. All these, when they come together, of course, they can actually simplify the process. Yet the process is still very difficult. Entrepreneurship is not easy, but it's so enjoyable at the same time. If you have the passion and you have the vision and you have the right team, then you can, and you have the grit, then you can actually go really deep into the journey and hopefully do something big and create a huge impact. Okay. This is who AVEY is. AVEY is very determined to really revolutionize healthcare using technology. And when I say revolutionize healthcare, I mean here transform the experience of people with healthcare. And by people, I mean the patients. We want to make their journeys more delightful. Providers, meaning clinics and hospitals, we want to empower them and allow them to provide higher quality care to patients while at the same time reduce cost and increase revenue. And insurers to automate as much as we could in their processes to allow them to be extremely responsive with the providers.
And how did the diagnosis model evolve from the moment you start until today? Where are we today?
So the way I define AI at AVEY is to innovate. And by innovate, I mean invent and commercialize. So to innovate an AI model that can do 5 things. That can reason, and in our context here we are talking about clinical reasoning, that can listen, that can speak, that can see, and that can feel. We spent actually a lot of time on the clinical reasoning part. Recently we started actually working on the speaking and listening. We haven't touched yet the seeing and feeling. With respect to listening and speaking, we started actually training a natural language processing or understanding model that can allow people to talk to AVEY in natural language. So
you are not replacing human doctors. You are empowering human doctors. You are empowering patients. You are empowering clinics and hospitals and insurance. You're just making everybody's job or life a little bit better, one step at a time.
True. And I can elaborate on that if you wish. So let's take actually the patient, the provider, and the insurer. Very quickly, with respect to the patient, if you feel unwell, you would love to know immediately why you are feeling unwell. Now you can self-diagnose with AVEY. At the moment, it's text-based. It's an interactive process. AVEY is available on Google Play and App Store. People can download it and self-diagnose with it. And scientifically, it has been proven to be the most accurate in the field. And that helps actually patients a lot. 2, when it comes to providers, and speaking of the natural language understanding model that we have been developing, that allowed us to do the following. So when the physician is sitting with the patient and providing the patient with a consultation, our NLP model, in collaboration with the diagnostic model, can listen to the conversation and on the fly extract the symptoms and predict their statuses, meaning whether the patient has any of those symptoms, doesn't have, or other. Communicate all these findings to the diagnostic model. The diagnostic model is interactive in nature, as I mentioned. It takes those findings and provide diagnostic insights in real time to the physician to reduce diagnostic errors.
Oh, so
it doesn't end there. Once the session actually is over, so this is what we call now in our enterprise solution or B2B solution, the collaborator, AVEY collaborator. Once the session is over, AVEY will write the note, the medical note on behalf of the physician. That saves the physician a lot of time, documentation time. There are some studies that show, for instance, in America, a physician spends out of an 11-hour working day on average, spends 4.5 hours on average just on documentation tasks.
Almost half his time.
Yes, and AVEY can now salvage that time back by automatically writing the note in the SOAP format, the subjective, objective, assessment, and plan sections of the note automatically once the session is over, so that we can give that time back to the physician and allow them to provide higher quality care to patients.
More patients even.
More patients, that increases the revenue, but even also allow the physician to enjoy more their jobs, because that's actually what they have been trained to do, providing consultations and diagnosing and helping patients, as opposed to just typing
entering data basically.
Exactly.
Amazing. And so my first statement here, if I understand correctly, AVEY is the most accurate health diagnosis system in the world.
To the best of our knowledge, we got a paper accepted at a top-tier medical journal. It's called JMIR AI in Canada. As a matter of fact, on April 29th, so it's very recent. The paper is available online. People can check it. In that study, we use the clinical vignette approach, which is the standard approach for evaluating the diagnostic accuracy of AI diagnostic models. AVEY competed in that study against 5 other solutions, global solutions, and came at the top. All the results are available, as I mentioned, in the paper. And even all the vignettes, by a vignette I mean an anonymized case of a patient that is deemed as a gold standard, which means it has been reviewed by a committee of doctors with certain criteria and characteristics and approved. And by the way, the testing did not happen by AVEY. As a matter of fact, it happened through committees of external doctors that tested these 6 solutions, AVEY and the other 5. Everything has been recorded, everything has been published online, everything has been peer-reviewed, and the beauty about that, AVEY came at the top.
The second statement is AVEY the first natural language processing medical diagnosis system?
So diagnosis is a problem, and NLP is another problem. Of course, NLP is a very old domain, and many NLP models have been applied in
different industries, you mean?
Correct. But what is unique maybe about AVEY is the following. So we wanted actually either the patients to talk to AVEY in natural language, or AVEY to listen to the conversation between the patient and the physician in a clinical setting. That will be actually, that conversation will be also in natural language, because typically the physician is not going to use a very hard language with the patient, and the patient will use natural language. Very quickly, when we wanted to train a model to that is able to apply what we call in computer science natural language comprehension or understanding on that text which is the conversation between the physician and the patient. We started by training the model assuming that text contains only one symptom at a time. That Of course, we needed to collect a lot of data, hundreds of thousands of entries from people like me and you and others. We asked them, okay, how would you express in natural language this symptom? And we collected a lot of data. We trained a language model, and the accuracy was really very high, more than 94%. When we tested that model on text that includes more than one symptom, it really collapsed. It went down to around, if I remember vividly, 17-18% accuracy. Of course, the natural thing to do next is to go and train the model on inputs that contain pairs of symptoms, then inputs that contain triplets of symptoms, and quadruplets, and you can name it. We started actually that way, and we realized, wow, it's going to cost a lot of money, a lot of data cleaning, a lot of course, data collection, data cleaning, a lot of training and cloud resources, GPU resources, and it's going to take time, a lot of time. The beauty about AVEY, we decided to solve this problem algorithmically, meaning that we wanted actually to predict the multiple symptoms in the text through a model that has been trained only through singletons. And we managed actually to develop a completely novel framework, fully developed at AVEY, that allows this, what we call in computer science, multi-label classification through a single label model. We are putting together a paper to submit in June 15 to EMNLP, which is one of the top tier conferences in computer science in natural language processing. And that is actually so unique and novel about AVEY. I believe AVEY, if I'm not wrong, is among the first to really develop that kind of model that can in real time extract these symptoms with a very high accuracy and predict their statuses.
Beautiful. But again, every startup needs to make money. How do you make money? Where's your business model as AVEY, and what you're trying to convince your customers to do?
Yeah, at the moment, the diagnostic model that we expose to patients, that's B2C, is free. It's free of charge. Anyone can download the app. Anyone can self-diagnose. Soon we're going to launch the NLP model on top of that within the app. People are going to be able to talk in natural language, not only like typing with AVEY. So that is free. The enterprise solution, especially the one that I explained for hospitals and the clinics, we have a subscription model. We give access to this enterprise solution to hospitals and the clinics. They can use it to co-write, meaning to automatically generate the note after a conversation between a physician and the patient, as well as to collaborate, which is the aspect that I spoke about in terms of the diagnostic insights that are provided to the physician on the fly during the thing. There is a third aspect, by the way, to this enterprise solution, which is after AVEY generates the note, AVEY also codes it using ICD-10 for symptoms and diseases, CPT for procedures and treatments, and NDCs here in Qatar, QNDCs for medications, and automatically generate the insurance claim that is supposed to be submitted to health insurance companies. So in summary, the enterprise solution encompasses three components: the collaborator, the co-writer, and the coder. We call it the 3Cs solution. It's subscription-based. Any hospital or clinic can access that system. They subscribe on a monthly basis. There are different tiers for the subscriptions that allow clinics and hospitals to tap more into the enterprise solution of AVEY, and that's how we make money.
So you are disrupting the medical industry here in Doha.
We're just warming up now. I don't know. I hope so. The idea is not to disrupt. The idea is to empower really patients, providers, and insurers. That's how we think about it. We are trying to solve a real world problem. We are trying to figure out the pain in the healthcare market and use artificial intelligence and computer science to address that pain. That's our objective.
So to simplify, each and every component or audience of those. I want to put 2-3 sentences about each of these 3 main pillars. What is, in simple language, what is the value for me as a patient?
Yeah.
If AVEY exists and is available to everyone, including clinics and insurance. What is the value for me as a patient first?
As a patient, you can self-diagnose with AVEY instantly and with a very high accuracy. If you feel unwell, you would get to know right away why you are feeling unwell. And by the way, in the study that we spoke about, the GMIR AI study that was published, AVEY competed against a panel of physicians with 16.5 years of experience and performed either comparably to them for some cases, and even for some other cases outperformed them. So it's really accurate and available instantly for you. It's at a click of a button you can activate it and self-diagnose.
So this is for the patient. What about the clinics and hospital? What is the value if today they go fully integrated, activating all of the aspects of AVEY's ecosystem into their softwares?
Yeah, the enterprise solution of AVEY, the B2B solution, has 3 major value propositions. Value proposition number 1, it reduces diagnostic errors. Value proposition number 2, it reduces documentation time. And value proposition number 3, it reduces denial rate with health insurance companies, because it does the coding and the claim generation and the auditing at the side of the provider automatically. As I mentioned, the name of the enterprise solution is AVEY 3Cs. The collaborator is the component that reduces the diagnostic errors. The co-writer is the component that reduces the documentation time. And the coder is the component that reduces the denial rate with insurance companies.
That's great for hospital and clinic, but that will upset insurance company. What are they getting out of this?
AVEY can be used by health insurance companies to do smart claim adjudication or processing. As a matter of fact, I strongly believe that you don't need doctors anymore to look at claims. Think about it. So the claim will have a set of symptoms, let's say one or multiple conditions, that these are the diagnoses or the diagnoses, the procedures, the treatments, and the medications. AVEY can now look at the claim and process it in a very unique way without getting into the details, and immediately. So you really can now empower health insurance companies to do claim processing in a very, very efficient and accurate and unique manner.
So you are saving them cost, making their work faster, more accurate, and easier, whether it is a clinic or an insurance.
True. And that's the vision of AVEY. As I mentioned from the get-go, that AVEY aims at empowering the 3 major stakeholders in healthcare: patients, providers, and insurers. Our solution, as you can see now, is holistic, because I do believe that this end-to-end solution could be the way to go to really transform the experience of these stakeholders with healthcare and health insurance.
Okay, great. So what is next for AVEY in Doha?
Well, in Doha now, we want really to push through our enterprise solution. We want to give it to as many clinics and hospitals as possible. Really to empower them. We want also, we'll be more than happy to work with the insurance companies to provide them with access to our AI to do smart claim processing. And that's pretty much now at the moment the plan for this year in Doha. Of course, we started thinking beyond Doha. We have a huge interest about the GCC area. And we also have a huge interest about the US market. As a matter of fact, we started some negotiations with some entities in the US. We have already reached an agreement with one entity there, and we started deploying our technology. in the US. We hope by the end of the year we're gonna have some good revenue coming from the US market as well as good growth, and that's pretty much for this year.
Okay. Global expansion of the company itself, of the team, full deployment to another country. What's your plan?
Well, the team now, as I mentioned initially, it's all based in Doha, especially the science and engineering team or teams. Of course, we're going to continue with that. The research is happening here and will continue. As we expand, it could happen also in other countries, but at the moment it's going to continue here because the team is very solid and is making a beautiful progress moving forward. Of course, as we scale out to different countries in the region or the US, you need salespeople on the ground. We are building a beautiful brand. We need PR, communication, branding, marketing. You need operations once you sell the product to the stakeholders that I mentioned. We are very, very much client-centric. We treat every client a VIP at AVEY. We try our best to delight them and make sure that the full operation starts and continues so seamlessly and professionally. So that would be actually in terms of investments as we scale out this year.
So we are today, if you talk about investment, today's AVEY is at the stage where you are looking at a Series A.
Yes, we started preparing for Series A. Our plan is to start it in Q4 2024. As I mentioned, we already closed the pre-seed round and the seed round, and Series A is coming. And the sole purpose of Series A is really to push for growth.
What is the current total investment that has been done in AVEY?
So far, the pre-seed round was around $1.4 million. That's the pre-seed. The seed was around $3.3 million. We'll see how much we're going to raise actually.
So we are at around 20 million real, 19 million, 80 million real?
You can do the math.
Okay. All right. What is the Series A? What is our target today for Series A?
We haven't really decided. We are still actually pushing for growth now and preparing for Series A. As I mentioned, there will be a need, and as such, there will be an ask based on that need to fulfill that need. That is something that we haven't fully decided upon, but we will see.
Okay, let's get a bit more question from here and there. What about the government and authorities? What are their thoughts and feedback on AVEY, and how much of an interest they have shown, and what are some integration that you see or foresee could be really helping the health ecosystem here in Doha?
We have reached an agreement to pilot AVEY at Hamad Medical Corporation. We already started this process, the deployment process.
That's an exclusive, right? You haven't mentioned that before, publicly.
Exclusive to you.
Yes. I don't think this was published before.
You are unique and you need something.
Thank you. This has not been published before. Okay, great. Sorry to cut you off.
We are deploying as we speak, but only as a proof of concept. It's a pilot at the moment. We are working hard to make that pilot successful. If it proves to be successful, then we can capitalize on that success to do more with HMC. If you ask me what are we trying to do, we are trying to again make the journey of any patient more delightful, whether in terms of self-diagnosis so that they can learn about their cases immediately, or whether it's about connecting with the right doctor, and make all the process much more seamless. That's what's happening at the moment. And in a nutshell, if I may, this has been going on so far very well. We are finding a beautiful support, and we are optimistic that things are gonna evolve in a good way.
Inshallah.
Inshallah.
So, based on my understanding today, I, as a patient, want AVEY to really work and be deployed, whether it is a private or public, because there's always issues, whether it is in money claims or payments or diagnosis or just booking an appointment is really a nightmare in Qatar, and everybody knows that, whether you are a local, an expat, or you are a visitor in here. How does AVEY help in appointments?
Yeah. So it's important actually to note the following. So AVEY is an end-to-end solution, and it has two components. It has the B2C component, and it has the B2B component. With respect to the B2C component, it involves, as a matter of fact, what you just asked about, meaning that as a patient, I can self-diagnose with AVEY and figure out why am I feeling unwell. But that may not be enough, because what if I really need to see a doctor? And the question becomes, which doctor is the most suitable doctor for me? We have been experimenting on the following idea. We provide the hospital with a system that can learn certain features about their physicians. For instance, Bofehd is an ENT doctor. Bofehd over the past 6 months, so cases XYZ with the frequencies 128, 39, whatever. Bottom line, the system at the provider side will get to know about the expertise of doctors on the conditions that they treat. So now when someone self-diagnoses with AVEY, AVEY would know the condition. On the flip side, AVEY would know the expertise of doctors on that particular condition. Then AVEY does what we call personalized matching and ranking. For your case, Bofehd, this is the best doctor, then this is the next best doctor, then this is the next best doctor. So that by itself is a recommendation system in essence. This is something that we are trying to push and deploy. It's not fully complete yet. And the moment you receive that recommendation, then the third question would be, how can I make it happen? And here comes the booking thing. We want you at a click of a button to book. We want you at a click of a button to rebook if you wish. We want you at a click of a button to cancel if you wish. And we want also the hospital to confirm with you automatically and to manage their no-shows and reduce the waiting time on you and improve the efficiency of the hospital as such, and the perception and the experience of the patient as such, through all that automation and AI-based operation.
So it's fully integrated with the booking system of those clinics and hospitals?
Yes, you can think of it actually as, we call the self-diagnosis component the check. We always use the C's, and we call that feature that you are asking about the connect. So this is the second C. So it's check, connect. And once you see the doctor, that's actually the collaborator, the co-writer, and then the coder.
I see.
So it's all C's, 5 C's.
I see. And what if I don't want to see a doctor in Doha? Will I have access to international doctors that maybe in Germany or in Denmark or in the US? I know this guy is really good. I want a consultation from that. Does AVEY plan to give me that privilege as a patient?
Yeah. So 2 things. First, AVEY is still a startup. And as a startup, we need to focus on one thing and get it done. So when I speak, it's important to note that this is in part what we have done, and in part what I see coming. So it's my vision as a founder to have these kinds of components as we move on. With that being said, think with me. When it comes to the connect feature, the connection between the patient and the physician can either happen physically, where the patient visits the physician at the clinic, or it could happen virtually. The moment when you start thinking about virtual connect, now you can connect the patient here in Doha, Bofhad for instance, with a doctor in Germany if that doctor is available on the AVEY platform. Or the doctor could be in the US, or the doctor could be anywhere in the world, even here in Doha. So that will actually, this virtual connect feature will allow us to do what you just spoke about.
Okay. And that will, even if he is not here, he will have access to the diagnosis. So he would look at what is currently my symptoms and all of that. I don't have to go through the same process again with a virtual doctor. Right? They will get some sort of an information of what AVEY has already diagnosed me with, right?
Well, that...
And the check feature.
Sure. So either you connect with the doctor after you self-diagnose with AVEY, or you connect with the doctor directly without self-diagnosing with AVEY. So this coupling, decoupling mode is something that we are thinking about. So I guess your question is, if I self-diagnose with AVEY, then and connect with the doctor, will the session that I have had with AVEY already be shipped to the doctor so that the doctor can check it out and provide me with a higher quality care? And the answer is yes. I guess there are some studies, as a matter of fact, that shows that if this happens, the doctor can focus with you more and provide you with a higher quality care. The bottom line here, AVEY wants actually to do two things. One, it wants to empower the patient and the doctor in this process. Two, it wants to protect the privacy of the patient and the privacy of the session that is happening between the doctor and the patient. With that being said, even when we ship that thing, everything is going to be encrypted, protected.
Yeah.
The doctor is going to be able to access that in a contained manner, fully contained manner and isolated manner, so that everything is protected.
Okay. So I want to go back to enterprise a little bit and look into the solutions that if I'm today, I'm an owner of a clinic or a hospital, and I'm going to call up today your business development team, or I'm going to call you and say, hi, what can you offer me?
I'll be more than happy, by the way, to receive any call. You can call me at any time. I'll make sure to pick up and delight you as much as I could. We are really very much client-centric. If you call me and you are a clinic, I'm going to tell you that AVEY is really here to empower you. I would listen to you on the pain points that you have, and then I would offer you the right solution to address that pain, if we have it. So if you have a pain when it comes to documentation, that we can automate through the co-writer. If you have a pain in terms of errors and quality of care, that we can actually address through the collaborator. If you have a pain in terms of coding and insurance claims, that we can address through the coder. You might have all these pains, we provide you with the full solution. You might have a subset of those pains, we provide you with a modular solution, because our enterprise solution, by the way, is modular. You can take one or many of these features the way you see suitable as a clinic or a hospital.
And once I'm deploying this, what will I be able to do?
You will be able to tap into the value propositions that we spoke about. You will be able now to, your doctors will be able to collaborate with AVEY for critical insights that they might need sometimes. Of course, they don't have to write, in essence, notes anymore. AVEY is going to help them out on that. AVEY also will code the medical concepts for you and generate the claims for you and audit them before they are shipped to the insurance company. So in summary, AVEY is gonna deliver the value proposition that it promised to you.
So today, the doctors is gonna have a more accurate, much faster, much easier time with the patient.
Absolutely. That's what we believe, and that's literally the essence of the AVEY solution, is really to empower doctors to provide higher quality care to patients, and as such empower patients throughout the process.
I'm a businessman.
Sure.
So by the end, as a hospital owner, I'm going to be able to utilize my resources, aka the staff or doctors, for more patients, and hence generate more money.
Right.
So even if I'm paying you on your SaaS model, I'm still making more money because I'm able to, really optimize my resources to generate more revenue. Is that correct?
Absolutely. And let's do simple math for that.
Okay.
So let's assume.
Wait, I will write that.
So let's assume that your doctor spends 2 hours or 3 hours or less or more. I really don't know. Different clinics have different numbers. Your doctor, let's just to keep things simple, your doctor is spending 3 hours on documenting or writing the notes.
Okay, let's say he's working 8 hours.
So let's assume that if he is working 8 hours, this means actually that he is seeing patients or talking to patients 5 hours, assuming there is 1 extra hour for break or whatever, but then 5 hours actually in talking to patients and providing them with consultations.
Okay.
Now, let's assume that the physician spends 20 minutes with each patient. If 5 hours are spent with the patients, this means that for every hour you can see 3 patients in every hour. You multiply 3 by 5, you are talking about 15 patients on average every day. Now, if AVEY through the co-writer can salvage back out of those 3 hours, 2 hours, right? Because AVEY is gonna automatically write the note on behalf of the physician. This means that AVEY got you now 2 hours, and with a 20-minute session with each patient, AVEY is gonna allow you to see 6 more patients. If now you make a certain number of riyals or dollars per each session, you can multiply that amount by 6, and that's an increase in revenue per physician per day. I don't know how many physicians you will have. You can do the math actually to figure out how much extra revenue you are getting by the end of the month.
So because for me, as a hospital or a clinic, I want the doctors to see patient, not to enter data. So you are eliminating that.
Yes.
From the doctor's hand.
We are automating that, and as such, allowing the doctors to do what they love, and allowing the patients to get a higher quality care from physicians.
I know you have answered this, but I want to go back to it just to enforce it and really capitalize and highlight it. How accurate is that?
Right.
Curator specifically.
The co-writer. Well, the co-writer is, of course, the physician has a full control on the note itself. I guess the way to measure this is not in terms of pure accuracy. Of course, it's a metric, but it's also in terms of how much time the co-writer is saving me. We hope that it can save maybe 60 to 70% of those hours that are lost on documentations, meaning like the example that I gave, you're spending 3 hours on documentation, maybe now you're gonna spend 1 hour or even much less. And the other time actually is now salvaged back so that you can enjoy more your work and let the patients enjoy more your service. By the way, this is not the only value proposition. This is actually the value proposition of the co-writer. When it comes to the coder, if you have a staff as a clinic going with the same example that you were going with, and you have a couple of gentlemen or women doing the coding for you and claim generation and preparation to be submitted to the health insurance, now that process can be streamlined as well. All the coding could happen automatically, and the claim generation can happen even automatically. and you can even actually audit the claim through AVEY to make sure that it's error-free, which will result potentially in reducing the denial rate with the health insurance company. So if your denial rate, you tell me it's 10% or 7% or I don't know, 20%, we hope now with AVEY that it's gonna become much less and as such get paid more, which also increases your revenue as such.
So let's continue with the enterprise and we look at the insurance here. How are you helping insurance process claims?
Well, as I mentioned, we can provide our AI technology to insurance companies to process claims in the following way. When it comes to the claim, you have typically two components. You have the administrative component and the medical component. The challenging part is the medical component. You can look at the claim and you can see that maybe there will be a list of symptoms. There is a diagnosis. There is a list of procedures and treatments, and maybe there is actually other medications. A medical doctor can look at that claim and make a judgment whether actually this diagnosis is justified with these symptoms, whether this procedure can be justified with this hypothesis, this diagnosis, whether this medication works for this diagnosis for this patient. All that is a medical judgment that can be done either by a human doctor processing the claim or by a rule-based software that can do what we call this crosswalk across diagnoses or ICD-10, procedures and treatments or CPTs, and medications or NDCs. AVEY actually goes above and beyond that. AVEY actually mimics clinical reasoning. So AVEY can extract the symptoms if they exist, produce out of those symptoms the differential diagnosis, not the diagnosis, the differential diagnosis, which is a list of diseases ranked from the most likely to the least likely, do what we call two-point matching between the DDX and the provided diagnosis in the claim. If that diagnosis is not one of those DDX, especially if the DDX is accurate, then this is alerted or rejected. So this validation at the diagnostic level is unique to AVEY. Then AVEY continues and says, okay, now if this is valid, are the procedures for that condition, for that patient valid? AVEY also does that processing. Are the medications valid? Are the medications together? Are the procedures together? How does that actually mesh with claims that you had as a patient in the past? So AVEY does not only do intra-processing, but also does what we call inter-processing. So it's what I call a memory full model. It doesn't forget it. So for instance, if in medicine, I'm not a medical doctor, but just let's assume in medicine that you cannot have anesthesia more than once every 3 months, this means actually that AVEY needs to remember that maybe you had a claim in the past and you already had anesthesia. If anesthesia comes now with another claim, AVEY is going to actually figure out, oh, you had it within 3 months, you cannot have it now, just as an example. So without getting much into the details, it's what we call AI-based processing. And again, this is what we can provide at the moment to health insurance companies to empower them in the claim management process.
So faster claim processing, more accurate claim processing, which means less money spent to clinics as well.
So faster and more accurate. Faster
Okay.
and more accurate.
In prison number, what is the current status in human time to process maybe, let's say, 10,000 claims? Whoa.
I cannot speak of that because that pertains to health insurance companies. They have these numbers. I can say that we ran 3 pilots so far.
Okay.
Again, we are a startup. It's important to keep things in context. We ran 3 pilots so far with the 3 health insurance companies. The pilot involved around 224,000 claims. AVEY was able to process everything within minutes. Of course, if we provision more resources over the cloud, we'll be able to do that. We can do that if we want instantly. And the accuracy actually was very high. As a matter of fact, sometimes I feel reluctant to mention the accuracy because it was really very high, around 97%.
For claim processing?
For claim processing.
What does it usually, for these 224,000 cases, what is the usual case for that pilot insurer?
You mean the accuracy typically if they
Yes.
are processed with
Manually.
either manually or
Or by care.
or through a rule-based software or a hybrid way. I don't know. That's something that health insurance companies need to be asked about. But I feel and maybe know a little that the accuracy is much, much less.
And how long does it take? How long does it take us with AVEY? 30 minutes.
Well, that was a pilot. If we want, everything can happen immediately. So
I'm just trying to
speed
compare.
and accuracy.
Okay. All right.
Speed and accuracy.
You don't want to talk about insurance so much.
No, again, it goes with the vision of the company to empower the three major stakeholders in healthcare: the patients, the physicians or the providers, and the insurers. And we think, we believe, as a matter of fact, that there is a way to come up with a system that can make all happy and transform their experiences in healthcare.
When are we expecting the NPL to be launched for the public?
I would say we are working very hard to have it launched in less than 3 months. So let's watch out and see.
If I'm a clinic, do I have access to a demo or a pilot at the moment?
For the enterprise solution, absolutely.
Okay.
Absolutely. So the coder, by the way, we launched it, as a matter of fact, last week. So the coder component of the enterprise solution, the collaborator and the co-writer are going to be launched within 3 months, as I mentioned, for the clinics and the hospitals. And once, because the co-writer needs the NLU model, once that model is ready, it can also be put on the app for the B2C solution, thus allowing patients to talk in natural language with AVEY. By that, Omar, I mean, and this is what I want to achieve, I want you to close your eyes and let's assume you woke up in the morning and you feel some stiffness in your neck. Say, "Hey, AVEY," and then he wakes up and says, "Good morning, Omar. AVEY, I woke up now and I am feeling some stiffness in my neck. Could you please tell me why?" "Oh, sorry to hear that, Omar. We'll be more than happy to help. Would you allow me to ask you a few questions?" You say, "Sure." Then a conversation happens between you and AVEY, say for a minute or so. By the end of that conversation, AVEY is going to provide you with a full assessment about your case. I want you to open your eyes. You should be shocked that you are talking to a machine, or more precisely to an algorithm, and not to a human being. This is what I am aiming for. If we can reach there, I'll be very happy. If not, I'll keep working harder and harder to get there.
What are the challenges? Before we go into that, because you said you're launching soon in 3 months, would you like to mention certain brands or hospitals or clinics who is really adopting and really always welcoming to such innovation, and AVEY is really working with your team to deploy, and who's early adopters? Would you like to mention some companies?
Yeah. So you see, as I mentioned, by the way, we are deploying now at HMC as a proof of concept, which makes actually, and it's very interesting, HMC among the early adopters of some of our technology, and it's very promising as a matter of fact. As I said, the coder has been launched simply last week. We have some clinics who want to try this as we speak, and we have reached out to tens of clinics as we speak, and we are now in the process of closing with some. And we hope the next time we talk within a couple of months to give you concrete numbers, because it's still early on. And I hope by the time we meet again, I'm going to mention that the co-writer is also in the market and the collaborator is also in the market.
Challenges.
Well, are you asking me challenges as a startup and in general for someone who is really into entrepreneurship? Or are you asking me about the challenges in developing that kind of a technology, or both?
Both.
Yeah. So one challenge actually is what I alluded to some time ago during the conversation, which is so we are a startup, which means actually we don't have, by definition, typically much money or much resources, and we want actually to innovate. I gave the example about the NLU model, where you can really go and solve the problem that I defined earlier through data engineering. You collect more data, you train for natural entries with more than one symptom. You need to go to pairs, triplets, quadruplets, and then you need to train the model really to be able to recognize that this entry actually has these two symptoms and they are X and Y. That's the typical way of doing that. This was very challenging for us because it's going to consume a lot of time, a lot of money, a lot of resources. The way we address that challenge, and I really recommend people to think that way, is to solve the problem algorithmically. So we literally actually stopped at singletons, meaning that we trained the model with only single symptoms, and we managed to create an algorithm, a framework that can do multi-labels or multi-symptoms or multi-concepts on top of a single label model. And the accuracy came to be very high, as I mentioned earlier. This was a challenging thing, by the way, from a scientific perspective. And we addressed it through science and algorithms. It was an eye-opener for me because it took us some time to figure that out. But we enjoyed the process because we realized, even if you don't have much resources, you can still innovate.
Do you still get surprised on the things that come up throughout the process?
Yes, we always smile and say, wow, this is so interesting, because it's a matter of discovery. We are working on interesting problems that are really, we are trying to create a positive impact here in the society. We are trying to help patients. We are trying to help physicians and so on and so forth. So we are on a mission. And we feel very excited and motivated all the time to do what we are doing. And while we are doing it, because at least myself, I'm a scientist by training, I get so excited about these problems that we encounter during the process. And the more, by the way, the harder the problem, the more I enjoy it. And that's me.
What are, as we get closer to the end of this conversation, if you may mention 3 main breakthroughs or moments that you really, enjoyed going through and achieving with AVEY?
I mean, once we finished the first version of the diagnostic model and we validated it externally through the clinical vignette approach, and it turned out to be at the top, that was a happy moment.
You knew what is it?
I knew that now it works, and it's important to note it's all teamwork. So I knew that my team and we succeeded on that thing, because this is a very challenging problem in computer science and medicine. That was a very happy moment.
So that's when you knew the sky is really the limit.
Yeah. The other happy moment is when we reached an agreement with HMC. As you know, it's the largest hospital in the country. I was very happy because they are serving now acting now as early adopters. This is very promising. This is a public hospital, and acting as an early adopter and subscribing to this innovative platform is a big deal. I was very happy actually when we reached that agreement. By the way, there are many happy moments and there are many sad moments. I can continue on and on with the happy, and I can
let's stay on the happy moments.
With the happy moments, especially that we are ending the conversation now. Of course, a third happy moment is this idea of the NLU idea.
Can you just explain what does NLU mean?
Natural language understanding. So this idea and how we solved, by the way, the problem of multi-label classification using a single label model, when we came up with that idea and we tested it and we experimented and we realized, wow, that it works, it was really a wow moment. Like, it was a beautiful insight that came to us, and it turned out to be useful and practical, and it works.
So we mentioned offline that Google aim to do something around that, but they didn't take that approach, right?
They published a paper about that. It's available. You can access it online. They tried actually a recurrent neural network RNN model to do this extraction of symptoms on the fly from the clinical conversations. And to the best of my knowledge, it stopped there.
Okay. What are some brands that supported AVEY in its journey since the beginning?
Brands, big brands or small brands?
Big and
Well, honestly, the biggest support that I got as AVEY was from family and friends. The angel investors who believed on the mission of AVEY, they trusted me as a founder. They gave me the money and allowed me to do, me and my team to do all the R&D. That is to me the biggest thing that has happened. My family, my friends, the angel investors, and it meant a lot to me. I'll be the happiest person when AVEY exits, that all these people who are so dear to my heart, who believed on the mission of AVEY and on the team to really go through this process and do an excellent job. It will be the happiest moment, by the way, maybe throughout this journey. Plus the happy moments, by the way, Omar, when we see the impact of the product that we have created on the patients themselves, on the physicians themselves. I hope that answers your question. Should I stop here?
No, I want names of companies, entities, government. Name those who are actually listened, and even if you haven't done an effort, just listen and try to support, whether it's with a grant, whether with a service, value in kind, whatever it is.
Sure. I mean, I mentioned HMC. There's also other hospitals like Al Imadi Hospital. We met with them. We are meeting this week. They seem to be very visionary, and I hope we can reach an agreement with them so that they can also become early adopters. There are many other decent small to medium clinics in the country. We are still here in Qatar. It's very important to say that. But we also started in the US slowly. We already got a deal with a company in the US. And we are actually in open discussions with some other companies. I prefer not to mention the names because we are still actually in negotiations and things have not been announced yet.
Okay. Fair enough. Is there anything you would like to mention?
Well, you asked me about challenges with respect to technology and challenges with respect to the entrepreneurship journey.
Let's do it.
Well, you see, there was a study that was conducted in the US that took around 200 companies, technology companies, 100 that failed and 100 that succeeded. All in technology, and they collected data about the 200 companies, did some analytics and analysis on the data to figure out why did those 100 fail and the other 100 succeed. And they found actually 5 factors. 1, the idea. 2, team and execution. 3, the business model. 4, funding, and 5, timing. And when they ranked them, they realized that timing actually comes at the top. You might create a beautiful product, but it's not the time, then you're not gonna get enough adoption. I believe actually it's very challenging to really come up with a solution that you know the problem, that you know that the problem exists, but you don't know the solution. That was the case of AVEY. This was a big challenge. Coming up with a beautiful business model also was a challenge because we are inventing a new concept in essence in the market. And to me, I view it like a bird with 2 wings. One wing is the technology wing, the other wing is the business wing. The bird will never take off unless the 2 wings actually flap in synchrony. We spoke a little bit about the business model, but that was also a challenge to figure out what works the best for the market that you are at, and even when you start scaling up or scaling out. Of course, the team and execution, I was lucky to hire talents from the education city, but that's typically a challenge for entrepreneurs. Some entrepreneurs get into regulation challenges and funding. As I mentioned, I managed to raise some funds, but again, it was not easy throughout the process, and it took us time, to be honest, to do that. So every bit of that journey was challenging, but guess what, Umar? Enjoyable.
I agree. Being there, still there, going through. Well, it's definitely hard, especially when you are a father, a husband, a professor as well. Must be really tough to go through this on a daily basis. But we have been to places as AVEY. And how close are we from being a unicorn?
To be honest, that's not the objective.
It's not. But since we started talking about entrepreneurship, it's always a hot topic to talk about in the startup world.
I think that that could happen, and I believe will happen as a byproduct of what we are doing. But our mission is really to again transform the experience of people with healthcare, to create a positive impact in the society using the endless possibilities of technology and artificial intelligence. These are very powerful tools that we can tap into to empower the health of people. That's what we are aiming for. If we can create that impact, then I would assume that we have succeeded. But it's not the end of the world. We're going to continue innovating and growing and bringing that positivity actually and that happiness and delight to patients and other stakeholders in the market.
So it's just a matter of time.
Yes, it's a matter of time. And I think it will happen. Don't get me wrong.
Of course, we both agree on that.
It's not my objective. I think it's going to come as a byproduct.
Correct, I understand that. So by the deployment and enrolling of the services, as it takes up in the market, mathematically it makes sense.
Yes, so it's important to note two things.
Okay.
Healthcare is typically slow. And science, when you develop something that is deep in science, that takes time. R&D takes time. So with these actually two things putting them together, you actually need time to get there. But guess what, man? We have already actually done something. I would say we're still warming up. But we have finished a big part of the R&D for whatever vision we had from the get-go, and I believe that now we are in the growth phase, and I hope things are going to continue picking up, and I hope we're going to hit what you are talking about, which is $1 billion valuation or more, but I don't know when.
Okay, let's wrap this up with a message from you to the entrepreneurs.
Well, I love the statement that says startups do not fail, but founders give up. Never give up. Keep trying, especially if you are trying something good and you believe on it. Hire good people around you because it's teamwork. And with enough persistence, you might actually reach really far in your journey.
Well, Dr. Muhammad Hamud, thank you so much for this. I think we have a lot of good messages. We can foresee what to expect from AVEY in the soon and long future. Shukran.
Thank you, Bufahd, for hosting me. It was a pleasure talking to you today, by the way. Thank you.